Hello everyone. In this video, I will be sharing another US FDA new drug approval update. On August 5th, 2026, the US FDA approved a oral small molecule Oveporexton, brand name ORZEYFUL, for the treatment of narcolepsy type 1, narcolepsy with cataplexy in adult patients. Now, let's dive into this medication in more details. Oveporexton, brand name ORZEYFUL. This medication was approved by the US FDA on August 5th, 2026, and indicated for the treatment of narcolepsy type 1, NT1, narcolepsy with cataplexy in adult patients. Narcolepsy is a medical condition with excessive daytime sleepiness, and most patients with narcolepsy type 1 have muscle weakness symptoms as well. As I recorded this video, this drug is currently under review by the U.S. Drug Enforcement Administration for scheduling pursuant to the Controlled Substance Act. Chemically, ORZEYFUL is an oral small molecule with sulfonamide and pyridine motifs. Molecule weight 520.5 gram per mole. Hydrogen bond acceptor 6. Hydrogen bond acceptor refers to the number of nitrogen and oxygen within the drug molecule. Hydrogen bond donor 2. Hydrogen bond donor refers to the number of OH and NH groups within the drug molecule. Log P 3.6, which is a lipophilicity parameter for the drug molecule. The higher log P, the more lipophilic drug molecule. Polar surface area 95.1 square angstrom. This medication is available as tablets. The strength of the tablets are 0.5 mg, 1 mg, and 2 mg with active pharmaceutical ingredients Oveporexton. Recommended dosage: either take 1 mg orally after awakening and then take 1 mg 3 to 5 hours later, or take 2 mg orally after awakening and then take 2 mg 3 to 5 hours later. Maximum recommended total dosage of ORZEYFUL is 4 mg orally per day. Basically, ORZEYFUL has a split dosing regimen, with taking pills in the morning and around lunchtime to mimic this diurnal effect from naturally occurring Orexin. For example, rising in the morning and declining at night. ORZEYFUL may be taken with or without food. Mechanistically, this medication works as a Orexin receptor 2 (OX2R) agonist, restoring the loss of orexin neuropeptide signaling by addressing the underlying mechanism associated with NT1. Pharmacokinetically, Tmax, the median time to reach maximum plasma concentration is 1.5 hours. The apparent volume of distribution at steady state is approximately 325 liters. Protein binding over 96%. Metabolism: Oveporexton is primarily metabolized by CYP3A4 enzyme. The mean terminal elimination half-life of Oveporexton is approximately 23.2 hours. Excretion in the urine 11.0%, with less than 1% being the parent drug molecule. In the feces 80.5%. Drug-drug interactions: strong CYP3A inhibitors. Concomitant use with ORZEYFUL is contraindicated due to increased Oveporexton exposure, which may increase the risk of ORZEYFUL-associated adverse reactions. Moderate CYP3A inhibitors reduce ORZEYFUL dosage to 0.5 mg orally after awakening and then take 0.5 mg 3 to 5 hours later. Total dosage is 1 mg per day. Strong and moderate CYP3A inducers. Avoid concomitant use of ORZEYFUL with strong or moderate CYP3A inducers due to increased metabolism and decreased plasma levels of Oveporexton, which may decrease the effectiveness of ORZEYFUL. Contraindications. ORZEYFUL is contraindicated in patients taking strong CYP3A inhibitors. The most common adverse reactions, greater than or equal to 5%, associated with ORZEYFUL include insomnia, polyuria, which is the need to urinate often, micturition urgency, which is frequent micturition and urinary incontinence, and salivary stupor secretion. Here are the key sources which I have used to prepare for today's video. The US FDA New Drug Approval Updates for 2026 is a very valuable resource. In addition, most of the medication information which I share today is based on ORZEYFUL prescribing information. This document is available on the US FDA drug website, along with the drug manufacturer website. Finally, I want to thank you all so much for watching. If you find this video helpful, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.